Over the next decade, we are developing the services we provide at Musgrove Park Hospital in an exciting programme called Musgrove 2030. This ambitious programme involves developing state-of-the-art facilities that will support our excellent clinical and non-clinical teams to further improve the care they provide to our patients. We are thrilled to have this opportunity to develop the facilities at the hospital, where our colleagues deliver care from some buildings which date back to the Second World War. We want to share with you some of the challenges our colleagues face while showing you our exciting vision for the future of Musgrove Park Hospital.
Musgrove Park Hospital was originally built 80 years ago and used initially as an American military hospital during the Second World War. These oldest parts of the hospital still house services such as our critical care unit, which cares for the hospital's sickest patients, as well as maternity and children's services. The old building has served us well over the years, but it is undersized for modern healthcare and the fabric of the buildings is deteriorating. Our colleagues provide excellent care to our patients despite the challenging environment of these very old buildings. However, the current way we provide planned care for patients means operations are likely to be cancelled when the hospital is very busy, particularly during the winter months. Extensive work is already underway to improve the settings of care at Musgrove Park Hospital. Over the last 2 years, we have opened a new ophthalmic theatre suite that has greatly improved the experience of our patients. We have refurbished our midwifery-led Bracken Birthing Centre thanks to a generous donation by our League of Friends and its fundraisers. We have transformed the reception area at our maternity unit and improved the environment at our antenatal clinic and labour ward. We have opened a new therapy centre that brings a range of therapy colleagues at the hospital together in one building, enhancing the care we give to patients. We have expanded our critical care unit to allow us to meet the additional demand and to allow us to safely care for patients who may need isolating due to infection control reasons, such as COVID-19. We have significantly expanded our medical teaching facilities so we can continue to offer the best possible education for our colleagues. We have completed an upgrade and refurbishment of our cardiac catheterization labs that has increased capacity by 50%. Recently, we have opened a new surgical decision unit. We previously named this the Acute Assessment Hub, that brings our surgeons, emergency doctors and other healthcare professionals closer together and crucially nearer our emergency and X-ray departments. We will open a sterile services centre in a brand new building that's closer to the location of our new surgical centre that will provide 6 new endoscopy rooms, 8 operating theatres, including a state-of-the-art hybrid operating theatre that can be used for both surgery and interventional radiology, patient recovery and clinical support areas, 22 critical care beds, all specified for Level 2 and Level 3 critical care patients.
In 2020, we were identified by the Department of Health and Social Care as a potential site for development as part of the government's National Hospital Building Programme. We have been awarded seed funding to develop plans for future developments at Musgrove Park Hospital and the next steps of our Musgrove 2030 programme, expected to include a new maternity and children's building, an elective care centre and further development of our emergency services. We will bring our maternity, obstetrics, gynaecology, paediatrics and neonatal services together under one roof, which will be closer to our operating theatres. We will develop new dedicated paediatric areas, including a specific paediatric emergency area, assessment unit and observation area, which will be co-located within the new integrated front door, a one-stop service that will assess whether a patient needs to be in hospital or not. We will co-locate our emergency and urgent care services into this integrated front door, which will give our urgent and emergency patients a single point of assessment, so that they're seen by the right person at the right time in the right place. Our elective care facilities will be brought together in one place, improving operational efficiency and flexibility, which will reduce our waiting times. Our Musgrove 2030 programme includes digital transformation, which will enable different ways of providing care. Over the last few years, digital ways of working have become the norm, with many outpatients appointments now taking place virtually, either video or telephone. We will introduce smart technology, including interactive wayfinding, personalised navigation and comfort control within our inpatient rooms. This will help to empower people to play a part in their own care, hopefully preventing them from becoming unwell. We will also replace our ageing estate and infrastructure and move the hospital towards a lower carbon future.
This is a fantastic opportunity, and we are working closely with the national team on the next steps to progress this scheme. There will be opportunities in the future for you to give us feedback on the scheme as we develop it.